Chapter 3, Psychopharmacology and Psychopharmacokinetics. This chapter will address issues related to psychopharmacology and pharmacokinetics, how drugs work and bring about chemical and behavior change in the body, and how drugs are dispensed and prescribed. It will provide some basic information that is helpful in understanding your client. Pharmacodynamics, which may be defined as the study of how drugs affect receptor sites, send signals, and cause some neurochemical changes. Pharmacokinetics refers to the administration, absorption, distribution, metabolism, and elimination of drugs inside the body. There are various routes of drug administration, as you can see on the slide. In more acute settings, such as a hospital or clinic, intramuscular injections are commonly used to control behavior. Long-acting intramuscular injections are used for more chronically mentally ill patients. When we're looking at drug absorption, when a drug is introduced orally, the rate of absorption is determined by the form of the drug. Liquids are absorbed faster than capsules or tablets. Slower extended release forms of medications allow for fewer doses per day and cause fewer side effects because of the slower rates of absorption. Oral administration has the slowest rate of absorption when compared to intramuscular, intravenous, and other forms available. Absorption usually occurs in the stomach and the small intestines. Some medications need to be given with food for better absorption, whereas others without food, so that may not interfere with the absorptions. With the distribution of drugs, drugs are delivered throughout the body by the circulatory system. The liver is the first organ that orally absorbs drugs that we encounter. It will break down some of the drugs into non-active metabolites. After leaving the liver, the drug is delivered to the target organ. For psychotropic drugs, the central nervous system is that target area. Other factors that affect drug absorption include protein binding, drug half-life, and lipid solubility. Protein binding, when we're looking at that, is some drugs bind tightly to plasma proteins. The protein binding phenomenon determines how much drug is available to act on the brain. Drug protein binding also hinders drug metabolism and excretion, which causes it to remain in the circulatory system longer. Drug half-life. The drug half-life is the average time required for that drug to be eliminated from the body. Drug half-life. The half-life of a drug is the average time required to eliminate 1/2 of the drug's concentration from the body. So, for example, alprazolam or Xanax, the brand name, has a half-life of 11 hours. The concentration of this drug will reduce by 50% after 11 hours, by 75% after about 22 hours. It takes approximately 5 half-lives for any drug to be eliminated from the body. Lipid solubility. The lipid solubility, or you call it fat solubility, of a drug determines how easily it crosses cell membrane, which is important for absorption and effectiveness of its target site. Drugs that are more lipid soluble cross membranes easily and are more likely to cross over the blood-brain barrier. Some drugs do not cross that barrier. Drug metabolisms. When drugs are metabolized or broken down primarily in the liver by P45 family of enzymes, the liver breaks down the drug into other forms or metabolites that are later excreted in the urine. A few of the psychiatric medications, such as lithium, are not metabolized by the liver and are excreted unchanged by the liver in urine. A patient with kidney dysfunction may not excrete the drug normally, and the concentration may become elevated and toxic. The therapeutic index is when a certain drug concentration given at a desired response. It is referred to as therapeutic index and dose. Certain drug concentration gives a desired response. When a drug concentration causes a mild or severe side effect, it is referred to as a toxic dose. The therapeutic index then is the ratio of the toxic dose to the therapeutic dose. Desirable drugs have a high therapeutic index because the risk of toxicity at the therapeutic dose is minimal. Drugs that have a low therapeutic dose index carry more risk because the therapeutic concentration is relatively close to its toxic level. So, for example, if we look at lithium, it's difficult to use because the toxic level is only slightly higher than the typical therapeutic level. So, as we are looking at these drugs, when we are getting the desirable effect with minimal side effects, that is what we're looking at as the therapeutic index, as opposed to a toxic dose. Although most medications are introduced slowly into the body, some drugs may be at high doses. Although medications are introduced slowly into the body, some drugs may be Although most medications are introduced slowly into the body, some drugs may be initiated at a high dose to obtain a certain desired response. We call this loading dose. We call this a loading dose of medication. After loading the patient, although most medications are introduced slowly into the body, some drugs may be initiated at high doses to obtain a certain desired response. We call this a loading dose of medication. After loading the patient, further dosage adjustments are seldom needed because we have introduced the therapeutic dose into the body all at once. When we're looking at tolerance and withdrawal, if a patient develops tolerance for a drug, he or she needs greater amounts of drug over time to produce the desired effect. When we're looking at tolerance and withdrawal, if a patient develops a tolerance for a drug, he or she needs a greater amount of the drug over time to produce the desired effect. Withdrawal from a drug is defined as a set of characteristic symptoms that emerge when a drug is abruptly discontinued after heavy or prolonged use. Withdrawal symptoms can be medically dangerous and require inpatient treatment. For example, a person who might be having alcohol withdrawals or withdrawals from any kind of drugs might experience symptoms such as agitation, tremors, insomnia, and it's because the body is thrown off and is in a state of shock because it no longer has that substance. Discontinuation syndrome. In psychopharmacology, we look at the discontinuation syndrome. This syndrome is distinct from withdrawal because it is not medically dangerous, although often report discontinuation syndrome. Psychopharmacology looks at the discontinuation syndrome. This syndrome is discontinuation syndrome. Psychopharmacology looks at this discontinuation syndrome because it is distinct from withdrawal. It is not medically dangerous, although oftentimes people may report that when they miss a dose or stop taking medication, they feel a malaise or other flu-like symptoms. Discontinuation syndrome. Psychopharmacology looks at the discontinuation syndrome. This syndrome is distinct from withdrawal because it is not medically dangerous, although some patients often report that when they miss a dose of their medication or stop taking the medication, they may feel a malaise or other flu-like symptoms. Potentiation of synergism. Potentiation and synergism. Potentiation means that one drug may enhance the effect of a second drug. So one drug that potentiates another drug may increase the sedation effect only twofold or so. Synergism refers to the fact that one drug may increase or may enhance the effect of the second drug significantly more than expected. Try again. Potentiation and synergism. Potentiation means that one drug may enhance the effect of the second drug, whereas in synergism refers to the fact that one drug may enhance the effect of a second drug significantly more than expected. So with the potentiation, it could be that if a person is taking a benzodiazepine and such as Klonopin and drink a glass of wine, it will enhance the sedation effect. However, with synergism, it is the fact that if the person is taking a drug, let's say that Klonopin, and might take it with another medication, a Benadryl, it might end up significantly impacting that client to a point where it wasn't expected. The sedation might be heavily, maybe toxic. So use this one. Potentiation and synergism. Potentiation means that one drug may enhance the effect of a second. So for example, if drug X is added to drug Y, it may potentially cause drug Y to become more sedating. However, synergism refers to the fact that one drug may enhance the effect of the second drug significantly more. So drug X added to drug Y may increase the sedation effect by sixfold, which is why a patient should not mix alcohol with benzodiazepines. The placebo response is when we're looking at some patients respond regardless of the specific therapeutic intervention just because of a helper's therapeutic interaction with them. So this person may receive a placebo even when an actual drug is not present. Cross that out. The placebo effect. Some patients respond regardless of the specific therapeutic intervention just because of help or the helper's interaction. Many patients have shown actual chemical changes in their brain when they receive a placebo, even when an actual drug is not present. The brain acts as if the drug were present, even though the medication is not. The power of the placebo response should never be underestimated. In the remainder of the chapter, please review prescriptions and pharmacy terms on page 17. There you will find the abbreviations for certain use. The last portion of this chapter is titled Prescription, Pharmacy, and Pharmacy. Use this. Please review Table 3.1 for abbreviations of prescription and pharmacy terms.